metabolic syndrome. If you have been here for a little bit, you've probably heard me talk about metabolic syndrome and the signs of it. But tonight we're going to delve into this with a medical provider. Holly is incredible. Trent's going to introduce her here in just a second. And I want to make sure those of y'all that are coming in, if you've got questions about metabolic syndrome, this is going to be a great call. This is going to be an incredible way to learn more about it. As somebody that had metabolic syndrome, which is, she's going to explain this really well. So I want y'all to stick around. Make sure if you've got questions, put those in the comments. I'm going to put a little Q&A here. But without further ado, I'm not going to waste any time. We're going to get this started. And this is going to be some great information tonight on metabolic syndrome.
Bit of fiber. And wait when you hear and see what this is doing for people's blood work, for their bodies, for their weight control, and many more things. So we're going to get to that in a moment. But I don't want to talk past the important point of tonight's call, which is our guest, Holly Ehrke. Now, Holly is somebody who I am very, very excited to hear from tonight. Holly is a FNP-C, which is a nurse practitioner. And Holly, if you've got your camera on, you might have it covered. We don't see your video yet. You might have a lens cover on, or maybe try putting, yes, the recording is on. Thanks for those of you who are checking. We don't see your camera just yet, Holly. There you are. We've got you. Okay, I'm not sure what you did there, but we have you now.
Okay, can you hear me?
I can hear you. Yeah, there's a little bit of a delay, but I can hear you. Can everybody hear me and Holly? Testing 1, testing 2.
I know my internet has been going in and out with the wind up here. So
okay,
hopefully this will work.
Well, Holly, let me just maybe give a brief introduction of Holly, and then I'm going to be kind of your assistant and show my screen as you talk through your portion tonight, Holly. We are very, very grateful to have you. Holly is a stranger to me, but somebody who I hope to get to know much better. She graduated from Michigan State University and has worked as an emergency room RN for most of her career before becoming a family nurse practitioner. Holly is married with 3 daughters and 2 grandsons, and she loves helping people become their healthiest versions of themselves. And so, Holly, I'm going to minimize my screen here, and we're going to share your screen. And maybe as I do this, would you mind telling everybody what really turned you on to this protocol and why you, as a family nurse practitioner, are recommending this to the people you love and care about and see?
Sure. I got interested in this protocol because a former patient of mine, who is now my neighbor, was having such success. And I hope he shared some of his slides with you that I can share at the end of the presentation. But with it, I feel like myself, I'm a pretty healthy person, and I'll admit I'm kind of a nerd. I like reading journal articles, and I like seeing the evidence before I'm going to help support something that I can use for myself and then help promote for my patients and family and friends. And with this protocol, there is evidence behind it that comes from Stanford University, the Cleveland Clinic, multiple journal articles where studies have been done to help support. And just seeing the evidence with my patient that I had, that we'll talk about at the end of the presentation, the transformation that he went through, and he was on the road to an early death, just because he had so many things. And see him now, he's like a different person.
Okay, so Holly, I don't know if the order of the slides as I have them is what you're expecting, so we'll see, and we can be flexible. But the very first slide that I see here is this one.
Good to see you. Tell us about him. Jerome?
Yes. So we're going to talk about tonight metabolic syndrome. What is, why it matters,
glad you're here,
and really drives the horse behind this disorder. So if you would go ahead, I'll just let you know when I need to change the slide. So go ahead and change This is my patient that I had met John approximately 6 years ago, working in a rural community health center, and he was not typically my patient. Day when he was assigned, I was working walk-in, and his normal physician assistant that he saw could not see him that day. And John saw me for several appointments for several weeks in a row. And the sad part about this was John was suffering from metabolic syndrome, which I'm going to discuss here in a little bit. And he was maxed out on 340 units of insulin a day. And when John shares his story, he shares that his dad died from an early age from coronary artery disease. And, just looking at him and his picture on the left, you can see he was not the epitome of health, to say the least. And when he came in to see me, he was having such bad neuropathy, which is nerve pain related to uncontrolled diabetes. And I do believe at one time, I want to say his A1C, I can't remember if it was like 11 or 16. It was like off the charts. And he was having a lot of diabetic nerve pain. He was having what's called diabetic retinopathy, and he was starting to lose his vision. And with that, there's medications that, you prescribe for nerve pain, but, I couldn't control his nerve pain. He was maxed out on medications. And, I did not have any tools in the toolbox to help him any longer.
Wow.
And so, fast forward several years later, John is now my neighbor and lives down the road from me. And, he's doing great. He is off all medications. He's leading a great life. And most of all, he's very healthy. So go ahead and change to the next slide. So what I'm going to talk about tonight is metabolic syndrome. And metabolic syndrome is not a single disease, but a cluster of metabolic risk factors that progress silently for years. Metabolic syndrome is a strong predictor for chronic disease such as type 2 diabetes, heart disease, and even stroke. And the elements of metabolic syndrome consist of 4 highs and 1 low. The highs include high blood glucose, high blood pressure, high triglycerides, a large waistline, and low HDL cholesterol.
More.
High blood sugar is defined as greater than 100 for a fasting blood sugar.
Right.
High blood pressure is greater than 135 to 140 over 85 to 90. A high triglycerides are greater than 150. A large waistline would be 40 inches greater for a man or 35 inches for a woman, and a low HDL cholesterol, which would be less than 40. And your HDL cholesterol is the one that you want to keep high because that's one that helps prevent with heart disease later in life.
Right.
So if you have 3 out of 5 of these elements, then most likely you probably have what's called metabolic syndrome. So go ahead on to the next slide, if you would. So why does this matter? Because only 7% of adults in the United States are metabolically healthy. So this means that there's 93% of us that are unhealthy. And some of the long-term effects related to metabolic syndrome, like I said, are type 2 diabetes, heart attack, stroke, fatty liver disease, cancer, dementia, polycystic ovarian syndrome, erectile dysfunction, and metabolic health issues. Diabetes, when left untreated, causes accelerated vascular changes with the blood vessels that can lead to neuropathy or macular degeneration. Hypertension, what's considered the silent killer, if left untreated, can lead to fluid retention, vessel dysfunction, cardiomyopathy, and sometimes can even lead to which is called congestive heart failure. High triglycerides are a predictor of coronary artery disease that can lead to stroke. And when the liver starts to suffer over time, it begins to overproduce high triglycerides, then which increases your risk for coronary artery disease, and then also increases the risk or increases the clearance of HDL cholesterol, which is the good cholesterol that you want in your body. And then with a high waist circumference, that leads to what is, the visceral fat that Trent had talked about. And this is related to inflammation that is happening in the body. And then the body deposits fat around the organs that can lead to chronic illness and damage. Some of the other signs, even before any of these 5 disorders happen, and Trent had already discussed this, were skin tags, which look like kind of like little tiny mushroom, like little attachments of skin that sometimes you'll see around the neck, maybe on the face or armpits. And then acanthosis nigricans, which is a darkening of the skin on your neck. And I always say it's kind of like ring around the collar. It has like a coarse feeling of the skin around the neck and is kind of like a wrinkly, but that's a sign of metabolic disorder. And if you're looking at these 5 disorders at a quick glance, they seem not to have too much in common. But like I say, like the 5 fingers of your hand, each one of these elements have one thing in common, and that is insulin resistance. On an interesting note, metabolic syndrome used to be referred to, it was called insulin resistance syndrome, which I found very interesting. So I don't know if there's another slide after this one, Trent.
X2 is the other one.
Yeah, okay. So with insulin resistance, it starts years before any of these disorders manifest. And then the question is, what is insulin resistance? Well, what happens, the cells stop responding to insulin, causing an increase of insulin floating, throughout the body. Insulin is a hormone that's made by the beta cells of the pancreas, and it binds to the receptors of the cells within the body. And it binds to all cells, it can be your liver cells, it can be, brain cells, lung cells, bone cells. And what happens, insulin, after you eat a meal, comes knocking on the door of every cell, and it wants to be let in. And some of the doors don't open, or maybe they're only open for like a crack. And so not every cell in the body fails to respond to insulin, but some of them aren't responding well. And then what happens in the body? The blood levels of insulin start to rise higher and higher and higher. And the pancreas then is trying to compensate by releasing more insulin into the blood. This causes then high insulin levels circulating throughout the blood, which is called hyperinsulinemia. And a result of hyperinsulinemia, then you'll start to see the fat storage increase, and then the fat burning is the part that then will shut down. So how can we reverse the root cause of insulin resistance? The main thing is promoting metabolic flexibility within our bodies. And, this protocol that Trent is talking about is one of the ways. But some of the things that we also can do is kind of forcing our body to switch over from burning glucose to more of a fat burning state. We can do lifestyle changes, which includes reducing ultra processed foods, watching our sugar intake on the foods we eat and the things that we drink, eating healthy fats, increasing our protein consumption, eating more whole foods as opposed to processed foods. A big one is going to be fasting for the 12 to 16 hours. Exercising 150 minutes per week. And I know that sounds like a lot, but it's really only 30 minutes, 5 days a week. And then once again, like I said, using the Feel Great system with the fiber and fasting is really the key to tackling insulin resistance. So that's my little presentation.
Well, I love it. And I want to stop right here for a moment because this is just fantastic. You made it so simple, where if we can stop the insulin resistance, we can stop the metabolic syndrome. And I love the fact that you had a patient in John who you saw go from, you articulated it better than I'm about to, but you said, have any more solutions for him? He was at the max dose of insulin, the max dose of medication. He was, 70 pounds heavier. His feet were hurting so bad, neuropathy, pain shooting into his feet. And to see him now, no more insulin, no more medication, no more neuropathy. I mean, you look at him, he looks younger, he's vibrant, he's alive,
Appreciate
right?
that. We're gonna stop the sharing and jump right back in here. So just kind of going through the whole presentation when it comes to dealing with our metabolic. I mean, that's really what we deal with here at Healthy Together, Feeling Great. And thank y'all for being here. I know there were a number of folks that have come through tonight. I hope this has been really helpful. If you had any questions, go ahead and throw those in the comments. I come on here anytime I can get a new webinar that I can share. I like to do this because this is great information. And when it comes to our health and what's going on, I mean, I always like to ask, really what is the question is, what is it that you want for your health? What are you hoping for when it comes to looking at this coming year? What are you longing for when it comes to your health? Now, there's different ways that we can approach that. As a nutrition coach, I always ask 4 questions. How are you eating? How are you exercising? What are your extras? And who are you encouraging? And a big part of metabolic syndrome is exactly what Holly was talking about in the presentation. How are you eating? What are you doing? How are you exercising? She talked about that. And what are your extras? And there she mentioned something called the Feel Great system. And if you're not familiar with the Feel Great system, it is a very simple protocol that makes sure that you're getting the vitamins and the minerals, the polyphenols, all of the things that your body needs to experience the health, like John, that has completely, and like I said, I've actually got his testimony, and I will need to, I don't have it queued up right now, but that's something I need to do the next time. So you can hear from John what it was like to be metabolically unhealthy. And, as a nutrition coach of trying to help people with the foods that we need to eat, recognizing the need for and the opportunity to experience the benefits of having something that helps along the way. Now, most of the time we think about medications. That's one of the biggest things, right? We think about medications. We think about things like metformin or GLP-1 resistor agonists. Those are all things that are super popular right now when it comes to addressing this. But there's other options, and that's part of what we talk about. The Feel Great system is that is really a 2-step protocol that is making sure that you're having the right amount of fiber that you have every single day and the right drink to drink that will help to stimulate your body's GLP-1. This is a Unimate, is an yerba mate concentrate. The Balance is a fiber matrix that is a complete game changer. That is a 7 blends of soluble and insoluble fiber that helps our body. It has been studied extensively at the Cleveland Clinic as well as the University of Sydney. Complete game changer when it comes to that. That's the Feel Great system. Before every meal, this is what John was using, and this is what I use. This is what I do every single day. Same thing my wife, Dr. G, does, is to make sure that we're taking the fiber, right, and we're taking and drinking yerba mate. Now, you can get regular yerba mate, but this is a concentrated, simple version. All it is taking it, opening it up, putting it in a bottle of water, shaking up, and drinking it wherever you go. And for what it amounts to is about $5.40 a day. So for the cost of a McDonald's dinner, you're getting the drinks and the fiber. You're getting 3 drinks that will help to sustain your overall health. Your HSA and FSA will support that as well. And the difference and the change that it makes in our life is absolutely a game changer. You come on here and you can see our videos. I need to probably do a testimonial video about Dr. G and I about what this did for us. I don't know that we've got anything really like that we share our own journey. And that's probably something that I need to set and record. But what I want to do tonight is, if you're on here to help you on this journey, is to get the benefits of what the Feel Great system is. And you got a chance to hear that. And if you're interested, I want to make sure that you have that opportunity. And maybe if you've got questions, you've heard me talk a little bit about it. And if you want more explanation of how it works, there's a number of different ways that we can do that. But if you want just the simplest thing is the link. You see that right down below. For $159 a month, it is what it costs. And you do that for, it has a 90-day money-back guarantee. It's HSA and FSA qualified, all right? It has multiple clinical studies on it. It has patents. It has over 5 patents on it. And we do our coaching. You get Dr. G and I as coaches on this journey. So you get the benefits, of course, of all the videos that we've got up here, all right? So what I want to encourage you to do is subscribe. If you need more information, right there is the QR code. Grab that screenshot. We've got the connections up in the video. Go check that, or on our YouTube page. Check that out. The link's there to order if you're interested in getting started. We've got videos that are about this and to help on this journey. What I'd simply like to say is I'm so glad that you came in tonight. If you do have, make sure that you subscribe. All right. We're going to continue to talk about these, the issues of nutrition, metabolic health. This was a great start. I've got to run, but I'm so glad that you were here tonight. Go get the day, make it golden. We'll